Rabies disease by Ines Maria Lodol. What is exactly rabies? Rabies is a virus caused by the rabies virus, which is a member of the Lysovirus genus. Characteristics of rabies virus. The virus is known for having a bullet like shape and having approximately 180 nanometers in length and 75 nanometers in cross sectional diameter. It's brown and conical in one side and flat in the other. Behavior. The virus attaches to the host cell membrane via G protein and enters the cytoplasm by fusion or pinocytosis, and binds to the RNP uncoated. Where does the rabies live and function? The rabies virus tries to establish itself in a nerve cell. The rabies virus is fragile under most normal conditions. It is destroyed within a few minutes in temperatures greater than 122 Fahrenheit and survives no more than few hours at room temperatures. The virus is no longer infectious once the material containing the virus is dry. Spreading the disease, the rabies disease. The virus is spread mostly. The rabies disease is is spread by direct contact with saliva, brain, or nervous system tissue from an infected animal. It's mostly transmitted from a bite of a rabid animal, but it could also come from scratches, abrasions, or open wounds exposed to saliva or other potentially infectious materials from rabid animals. Rabies virus protections. Here are some things you can do to protect yourself from getting the virus. You can wear gloves if you handle your pet after a bite. Keep family pets indoor at night. Up to date on your pet's rabies vaccines, and wash animal bites or scratches immediately with soap and water. History of rabies disease. Rabies have been around since around the year 2000 BC. The first written record of rabies is in the Mesopotamian Codex of Eshnunna, circa 1930 before Christ. Louis Pasteur, a French scientist, in July 6, 1885, cured Joseph Menister with a new vaccine he created. Almost every country on the planet suffers from rabies, but Asia and Africa have always been the most cases. Now, Africa In Africa, rabies causes at least 4,000 deaths per year. In the past, an unconfirmed epidemic of rabies in dogs occurred in western Zambia in 1901. In Asia, approximately 30,000 people die per year due to rabies. A high death rate was experienced in India in 2004. Symptoms of rabies virus. In the first few weeks, the symptoms are similar to flu. These include weakness or discomfort, fever, or headache. As the virus evolves, confusion, anxiety, hallucination, hydrophobia, and sleeplessness are some of the symptoms. Science in rabies virus. Currently, there is no effective treatment for rabies when symptoms develop. However, because science was used, there is a vaccine that can help cure rabies before symptoms appear. These are a series of shots that are given in an adult shoulder and in child's on the thigh. The shot should be given immediately after the exposure, followed by another 3 days, 7 days, and 14 days afterwards. The individual should also receive a rabies immune globulin injection, also known as RIG. If the medicine is given in the right time and properly, PEP is 100% effective in preventing rabies. As previously stated, there is no effective treatment for rabies when symptoms develop. And in this article, researchers from the University of Oxford have presented fresh data from a phase 1 clinical trial investigating the immune response and safety of their newly developed single shot rabies vaccine. For treatments covered by health insurance, typical expenses include a copay of $10 to $40 for the doctor visit and a copay for each of the doses of the vaccines. However, treatments for people that are uninsured do exist. The costs range from $500 to $1,200. Prognosis. Rabies is fatal in over 99 of the percent of the cases. If no treatment is given since to the patient after 24 hours, there is no way to cure since symptoms might begin. If the patient is given PP immediately after the bite, if you do not get a cure, the timeline for your rabies survival is from 1 to 2 weeks. Therefore, you have low to no possibilities of being present on the day of the presentation. However, if you do get treated immediately, you most likely would be in the presentation. Implications. Environmental implications. Although vaccines do save a lot of lives, they also contribute to climate change and pollution. This is because the equipment that the machines that they use to produce the medicine emit greenhouse gases, therefore impacting climate change. The materials that they use for the vaccines, such as syringes, needles, and alcohol swabs, are later thrown in the oceans, causing pollution. Economic implications. If people that work with animals are being infected by rabies, but there is a vaccine to cure this, people could return to their jobs. If there is a cure for the virus, there will be less money spent in emergency rooms. Another thing that impacts are the costs that cost around $5.5 billion per year. Are you getting are you ready to show all of you learned in this presentation? Pause this video and consider those questions. Where does rabies live and function? What two places are the most common to have rabies virus in the world? Is it true that rabies does not have a cure once the patient shows symptoms? If you got them right, you're doing an awesome job. If you didn't get them right, you should consider watching the video again. Thank you.